I am the Legislative Issues Chair for the Nurse Practitioner Association of Long Island. I am also the Parents of Kids with Infectious Diseases online advice nurse. I like pediatrics. First of all, children are wonderful human beings, and what you see is what you get. But I think what is very special about pediatrics is you not only are caring for the children, in an indirect way, you're caring for the entire family, because you can't take care of the child outside of the context of their family. I have an extensive background in public health, over 40 years of experience as a nurse. I have made it a mission of mine to learn about immunizations and vaccines, and I've been very fortunate to work with a lot of really wonderful people with various state health departments, as well as the Center for Disease Control and Prevention, and other nationally recognized leaders on the national level to learn about immunizations. I've also written extensively on vaccines and practiced and have a large practice myself. I think an average day for me is seeing a large number of children, making sure that they're vaccinated and making sure that we talk to their moms or their dads or their grandparents and giving them the tools that they need and the information they need to care for their children and keep their children healthy and well so that they can grow up to be a healthy, productive adults. I think some of the common issues that we encounter in my work with vaccines is people who are opposed to immunization. There's a lot of stuff on the internet and in the press about the danger of vaccines. The danger is in the diseases that these vaccines cause. We have any number of studies, very well designed studies, that clearly indicate the vaccines are safe. But I think with a lot of what we've heard in the press has really frightened a lot of parents about vaccines. And I think we really, as healthcare providers, need to take a step back and really listen to what those parents are saying and address their concerns and make sure they feel good about what they're doing for their children. I think the biggest challenge is ensuring that we get vaccine into all children and all adults too. That's a new thing, really. We never really thought about vaccinating adults. It was always looked at as something you do for children. But we have more and more vaccines for adults now than we ever had before. I think the biggest rewards for nurses in this area are the tremendous feeling of satisfaction that you get from knowing that you kept adults and children healthy. That's always been nursing's focus, is healthy and teaching people the strategies that they need to stay healthy. There is a lot of sadness in the world and a lot of sick children, a lot of sick adults. And to be in this particular phase of nursing is a positive thing and something to look forward to, and helping parents provide for their children so that they are going to have a healthy life is very, very gratifying. I think one of the biggest skills is our communication skills. We need to be able to explain to families how the vaccines work, be empathetic, listen to what the parent is saying to us, listen to the questions. Adults also have so many questions. I hear it all the time about many of our seniors believe that they can get influenza from the influenza vaccine. I think nurses really need to be well educated how to address these issues to allay that anxiety so people feel comfortable about their immunizations that are really necessary to keep them healthy and well. They have to be very adept at keeping up with the changes that occur. Immunizations, I always tell people, changes while you're sleeping because it's such a quickly progressing science. We can get up the next morning and we find new vaccines, new criteria for giving them. And I think it's very important for nurses to be part of web listservs or the computer now makes it so easy because you can sign up for listservs that you get up in the morning and they'll tell you what's new in immunizations and the good science behind it. And I think that's an important thing. It's also very empowering for nurses to have that kind of education. I've seen many nurses answering docs questions about vaccines because those nurses do have the access, and because it's their specialty, they've kept up with what the newest regulations are and changes, and are able to educate their nurse colleagues, their physician colleagues, as well as parents and families. I have to admit, I'm a mature lady. I'm a diploma graduate. I'm a very proud Bellevue graduate. And we had such superb faculty that they clearly indicated what was expected of us as nurses and educators. And I think when I think back to what they said to us and how they really emphasize how nurses are communicators and educators, and that's our big role. And that's what makes us so well respected by the public, is our honesty and our integrity. Oh, I think the most significant changes are the evolution of nursing education. As I mentioned, I'm a very proud diploma graduate with several other degrees layered on top of that. But I think what one of the largest changes I've seen is how nursing education has changed from being just a skill, teaching it as a skill set, as to now it's being taught as evidence-based practice. Years ago, we did use whatever kind of science we had available, but I think we have so much more science now and so many more nurses who are actually doing research and getting that research published. And we want to use evidence-based practice wherever we possibly can. And I see that as a real progression. And I think nurses are really leaders in that area when we think about some of the areas of EBP or evidence-based practice, and how nurses have really taken the lead in implementing that. We know we don't have enough doctors, and the focus of the physician is to cure illness. Nurses are looking to keep people healthy. Nurse practitioners work very hard to keep people healthy. And I think as part of the team, this is the way nursing is going to progress. It's going to be a real team effort between the physician, the nurse practitioner, in moving ahead to provide health care for everybody in the United States. Well, first of all, I would want them to make sure that they seek out a program that is going to steep them very well in evidence-based practice, how to search quickly on the internet for the best available evidence, how to come up with a clinical question when in their practices. These are the kind of experiences that nurses really need to look for in nursing education programs wherever they go, because they need to continue to be leaders and to step out in the front and be the leaders that they are. Well, I think they want to ask questions about what kind of clinical experiences they will be getting, what is the relationship, how many instructors or faculty members do they have in proportion to the number of students in the program, what kind of clinical experiences are they to expect? Ask about evidence-based practice. I would be thrilled if the student came to my school and had read and knew that evidence-based practice was the way that nursing and medicine were being practiced today, and had some questions about how they would be taught and what is the curriculum related to that.